Welcome back to Open Tuesday. The first COVID-19 shutdown began March 2020 when the city became the U.S. epicenter in the early days of the pandemic. With new mask mandates and vaccines, are we ready to fully reopen our city? How do the experts feel? Joining us now to discuss this and more is Dr. Indu Warrier, Senior Medical Director at EmblemHealth. Welcome, Dr. Warrior. Thank you so much for joining us today.
Thank you for having me.
Of course. So as I mentioned, Doctor, Governor Cuomo and Mayor de Blasio did announce an anticipated full reopening of New York City on July 1st. How are medical professionals like yourself feeling about this? How are cases doing? And do you think New York City is ready to reopen?
You know, that's a very good question. It is actually really exciting that the city is ready to open, that Governor Cuomo and Mayor de Blasio think that the city is ready to open. Social isolation had been a significant challenge during this pandemic for many people, and just not being able to socialize with other people, not being able to see other people had been pretty difficult for most people. Psychological health had been affected because of this isolation. So it's good to hear that the city is opening up, but on the other hand, we still have to continue to be smart. You cannot remove your mask, gather in groups, or take advantage of the reopening until 2 weeks after you have received the second dose of either the Moderna or the Pfizer vaccines, or if it's a J&J vaccine, then just the one vaccine is enough to protect you completely. So you have to make sure that you're fully vaccinated, that you're fully immunized before taking off your masks. We still have to follow mask mandates that are set up by individual businesses because it's their prerogative, it's their right to set up the rules for their businesses to be safe. We also have to keep in mind that children under 12 are not approved for vaccination yet. And for many people, this will be a time of transition, and we really have to be respectful of one another as we navigate these changes. So as far as infections are concerned, yes, they are decreasing across the city. There are more than 50 zip codes that have reported about a 7-day positivity rate that is below 1%. There's not been a single community in the 5 boroughs that have had a 7-day positivity rate exceeding 3.5% between May 6th through 12th, according to the city's health department data. So yes, this is good news that the cases are decreasing, but again, it's always better to be safe than sorry.
Absolutely. Thank you so much, Doctor, for that important reminder that we should still have precautions and we still should take measures. Although everyone's excited to have the city reopen, we have to be safe with each other. So, Doctor, there are new variants of COVID. Are they more contagious? And what are the variants? Can you explain?
So yes, there are quite a few variants that have been noted, and they have actually been noted in New York City also. The first one that was found was a variant that was initially noted in the UK. There was another one that was observed in South Africa, a third one from Brazil. All these variants are known to be more contagious than the initial form of the virus that we saw back in March of 2020. But the good news is that from the data that we have, all 3 vaccines, the Moderna, Pfizer, and the J&J vaccine, are all known to be effective against them. So the faster we can get vaccinated, the faster we can defeat all these variants and be in a safe place.
And Doctor, speaking of vaccinations, a lot of people are still hesitant about it. So next, I'd like to go through 3 of the most popular reasons for vaccine hesitancy, so you can help us understand the true facts and the myths behind these ideas. So the first one is the COVID vaccine causes infertility. Doctor, true or false?
That is actually not true. There is absolutely no data to support that the vaccine causes infertility. The American College of Obstetrics and Gynecology, that is the OB-GYN Association, and the Society for Maternal Fetal Medicine have recommended that the vaccine be given for pregnant people. So you know for sure that it doesn't cause infertility. And the reason they have recommended that these vaccines be given to pregnant people are because, pregnant women are usually more likely to be at risk for severe illness if they contract COVID-19 compared to non-pregnant women. And also, when you get the vaccine during pregnancy, most experts believe that you will respond with and produce antibodies, which can then be transmitted to your baby to afford protection to the baby. And also, it can be transmitted through the breast milk to newborns. So all in all, pregnant women should be getting the vaccine. There's no reason to avoid vaccine during pregnancy. And no, it does not cause infertility.
Thank you, doctor, for breaking that down. So the first one was false. The second, doctor, is vaccine can cause COVID-19. Is that true or false?
That is also false. Vaccine does not cause COVID-19. Getting the vaccine, in some people, they have noted symptoms like fever, muscle pain, but that is not the same as getting the COVID infection. And that is the most important thing to differentiate between the symptoms of the vaccination versus an active COVID infection. These vaccines are given to make sure that the body mounts an immune response, develops antibodies to fight the COVID infection. It does not in itself cause a COVID infection. And it helps, getting the vaccination keeps you and your community safe.
Got it. So another false on the second one. And the third one, doctor, is the vaccines are not FDA approved. Is this true or false?
This is, it's kind of a nuanced answer. It is FDA approved under what's called the emergency use authorization. And what that means is that these vaccines are safe to be administered, and we do have quite a bit of data to show that they're effective and they're safe. The difference, though, between a full approval and an emergency approval is that for a full approval, we do monitor what's called long-term data. So how the vaccines do, what are the problems associated with any vaccination, and how well does it work in the community for after having been given that for a long period of time. That is the point of data that we're missing. But in this situation, this is a very unusual situation. In this pandemic situation, we need to make sure that we are able to protect our population, we are able to protect people, and that's why these vaccines were approved under the emergency use authorization.
Got it. Thank you so much, doctor. I think it was really important to break down those myths and debunk the myths so that folks, feel more secure, especially coming from a professional medical doctor such as yourself. So thank you. So I'm curious, how are vaccination rates doing here in the Bronx in particular? And what do medical professionals suggest to Bronxites who are still unsure about vaccination at this point?
So the Bronx is actually doing reasonably well as far as vaccinations are concerned. So as of Thursday, May 13th, approximately 29% of Bronx residents had received the vaccine. And now that New York City is allowing for walk-in vaccinations at all sites and have established a number of pop-up sites in places like subway stations, etc., vaccines are now more accessible than ever. And for Bronxites who are still unsure about vaccination at this point, I have two messages. The first one is there are a lot of risks associated with getting a COVID-19 infection. So aside from just the risk of the severe illness and even in some cases death, there are also possible long-term effects. There's shortness of breath that can last for a long time, fatigue, migraines, brain fog, loss of smell and taste, which may seem like a small thing, but it really affects your quality of life. So getting the vaccine will definitely protect you from all these risks. And number two, get vaccinated for the sake of your loved ones and other people in your community. So getting immunized isn't just about you. It is about protecting the people in your life that you care about.
So, doctor, we mentioned this a little earlier, but I want to kind of break it down. Recently, the CDC announced that vaccinated people do not have to wear masks indoors or outdoors. Can you help us understand the research behind this update? And also, how should we expect this to be regulated?
Again, this is not an easy question to answer because there are multiple factors that go into making this decision. The CDC made this decision on the fact that vaccines that have been given so far, the Pfizer vaccine, the Moderna vaccine, these have all proven to be very effective in healthcare workers. 97% 97% of the people who got the Pfizer vaccine did have, it did prevent symptomatic infection, and about 86% of the people who got the vaccine were noted to not have any asymptomatic infection either. So we know that these vaccines are effective in preventing infections and also decreasing the severity of the infection. What we don't know for sure is whether it prevents people from being carriers. And the thought is that, yes, people can still be carriers and can give it to other people around them. So that is the reason why, even though the CDC is recommending that fully vaccinated individuals do not need to wear masks, either in an indoor or an outdoor setting, it again behooves us to be careful to make sure that we do not act as transmitters of the disease to people we love and other people in the community. So it's always a good idea to continue to wear masks and to be careful.
Thank you so much, Dr. Warrior, for joining us today and giving these important COVID-19 updates. How can people stay informed and, stay updated with EmblemHealth?
You can actually visit the EmblemHealth.com website for more information.
Thank you so much again. Dr. Indu Warrier is the Senior Medical Director at EmblemHealth. Thank you. We really appreciate your time today.
Thank you for having me again. This is really, I enjoyed it. Thank you.
Likewise. Thank you. Open BXRX Tuesday. We'll be right back.